Okay, let's unpack this. You know, when I first started digging into the sources for this deep dive, the idea that just like a common grass could cause such widespread and often really devastating issues in horses was genuinely, well, shocking.
It is surprising, isn't it?
Yeah. So today, we're pulling back the curtain on a critical, often silent challenge in equine reproduction, fescue toxicosis in pregnant mares. Our mission, as always, is to take your articles, your research, your notes, all that stuff, and really extract the most important nuggets of knowledge, give you that shortcut to being, properly informed.
And ready to synthesize this complex info.
Exactly. And joining me is our resident expert.
It's good to be here. And what's truly fascinating, I think, is just how significant this silent threat really is.
Silent is a good word for it.
Yeah, it's a problem playing out, in hundreds of thousands of pastures across millions of acres, often without owners even realizing the potential danger that's just lurking in their fields.
So let's peel back the layers then. Let's understand how it works, starting right from the basics. What exactly is fescue toxicosis? Give us the definition.
Okay, so at its core, fescue toxicosis is a specific set of problems we see in pregnant mares. It happens when they ingest tall fescue grass, that's Lolium arundinaceum, or Festuca arundinacea, just the scientific names for it.
All right, common grass.
Very common grass. But the key is it has to be infected with this tiny fungus called Epicloecoenophiala. This fungus, it lives in this sort of cooperative or mutualistic relationship inside the plant tissue itself.
Like a hidden partner.
Exactly.
Sure.
And the problems really arise particularly during late gestation, specifically after gestation day 300. That's the critical window.
And what makes this cozy little relationship problematic for the mares? Why is the fungus bad news?
Well, the problem comes because this internal fungus, this endophyte, it produces toxic compounds. These are a group of ergot alkaloids. They affect blood vessels and nerves. So we call them vasoactive and neuroactive. And ergovaline is the primary culprit we worry about. Think of these ergot peptide alkaloids as mycotoxins, basically a toxic byproduct of the fungus just living its life.
Okay, ergovaline. So here's where it gets really interesting for me. How do these toxins actually cause the problems in the mare? What's the hidden mechanism going on?
Right. So the ergot alkaloids, especially that ergovaline, they exert their toxic effects primarily through, well, two main actions. First, and this is the most significant one for pregnant mares, they act as dopamine D2 receptor agonists.
Okay, dopamine agonists. What does that mean in simple terms?
Because they basically stimulate specific receptors in the mare's pituitary gland. And when they do that, it powerfully suppresses the release of a hormone called prolactin.
Prolactin. Okay, I know that's important.
Absolutely crucial. Prolactin drives mammary gland development, milk production, the final maturation of the fetus late in pregnancy, and really importantly, it helps initiate parturition, the actual foaling process.
So if prolactin is suppressed...
It's like the mare's body forgets how to kickstart birth and make milk. The signals just aren't there.
Wow. Okay. And you said there was a second action?
Yes. These alkaloids also have an alpha-adrenergic agonism effect. Basically, that leads to vasoconstriction, a narrowing of blood vessels.
Like squeezing a hose.
Exactly like that.
Yeah.
It restricts blood flow. Now, while it's maybe less obvious in horses than, say, fescue foot you hear about in cattle,
Right.
this reduced blood flow can still contribute to things like compromised placental blood supply, impaired thermoregulation, difficulty handling heat, and in rare, severe cases, even laminitis.
Laminitis, wow. From grass.
Potentially, yeah, due to that reduced blood flow to the hose.
Yeah.
And they can also mess with other hormone levels, like reducing progesterone and increasing estradiol-17.
Okay, given this this really intricate mechanism, it sounds like this isn't just a rare thing affecting one or two mares. It seems like it could be, well, a silent challenge playing out across the country. How widespread is this issue, really?
Oh, it's incredibly significant. Tall fescue covers over 35 million acres in the USA. It's particularly prominent down in the southeast, but honestly, it's found across much of the eastern USA, and it's even grown for grass seed out in the Pacific Northwest.
35 million acres.
Huge tracts of land. And the vast majority, we're talking over 95% of these tall fescue pastures, originate from this one variety called Kentucky 31, which was released way back in 1943. And it was basically contaminated, or rather infected, with this endophyte from the start.
So most of the common fescue out there has this fungus.
The vast majority, yes. And it's estimated that somewhere around 688,000 horses are kept on tall fescue pastures. Now, consider this. A sobering survey indicated that among pregnant mares grazing these fescue pastures, a staggering 53% were agalactic.
53% had no milk.
None, or very little.
Mm-hmm.
38% experienced prolonged gestation, went way over their due date, and 18% had stillborn or weak foals that unfortunately died shortly after birth.
Those numbers are truly alarming. So, okay, what does this all mean for the mares and their foals then? Who is most at risk, and what does it actually look like when a mare is affected? What are the signs?
Well, the mares most at risk are definitely those in late gestation. That last 30 to 90 days of pregnancy, particularly after day 300, that's the most critical period for exposure and for symptoms to actually develop.
Okay, last trimester, basically.
Yeah, exactly. And the classic signs in the mares often pop up during these final 30 to 90 days. The most common, the most undeniable red flag is prolonged gestation.
Carrying the foal for too long.
Way too long. Mares can carry their foals anywhere from, say, 14 days to over 60 days beyond their expected due date. Normal is around 320 to 360 days,
60 days, that's 2 extra months.
It can happen.
Yeah.
And this is directly because that prolactin suppression is interfering with the natural foaling triggers. The body just doesn't get the memo to start labor.
Okay, what else?
Another hallmark sign is agalactia, or hypogalactia. That's a complete absence or a really marked reduction of milk production. The mare's udder often stays small, undeveloped. It fails to bag up properly before foaling.
So, no udder development even when she's overdue.
Often, yes. And if she does produce any milk, it might be thin, brown, or straw-colored, and the colostrum quality is usually very poor. Imagine seeing a mare who's gone over her due date by a month, maybe more, and her udder still looks like she's not even pregnant. That's just a classic heartbreaking picture of fescue toxicosis.
That sounds awful and dangerous for the foal.
Extremely. And because of that prolonged gestation, the foals keep growing in utero. This often leads to dystocia, which is difficult foaling.
Because the foal is too big.
Exactly. You get these oversized kind of dismature or post-mature foals. They might be large, but they're often underdeveloped in crucial ways, almost like a toddler in a grown-up's body. It makes the birth incredibly difficult and dangerous for both mare and foal.
Okay, what about the placenta?
That's another big one. You often see thickened or retained placentas. The placental membranes, the choriolantua, can be abnormally thick, swollen, almost leathery, sometimes hemorrhagic.
Leathery.
Yeah, it's quite distinct. This can lead to a red bag delivery, which is a real emergency where the placenta separates prematurely, cutting off the foal's oxygen supply. Or the mare might retain the fetal membranes after foaling, which is a setup for serious complications like metritis, that's a uterine infection, and laminitis.
So the problems continue even after birth.
Absolutely. And less commonly, you might see mares with reduced sweating or heat intolerance. And if there's severe exposure early in pregnancy, it could potentially even lead to early embryonic death or abortion, though that's less typical than the late-term issues.
Okay, that covers the mare. What about the foals, if they survive the birth? What state are they usually in?
Well, sadly, stillbirths are quite common. If they do survive, they're often born as weak, dismature foals. They might look large and gangly, but have long, fine hair coats, poor muscle mass, overgrown hooves, and sometimes their incisor teeth haven't even erupted properly.
So big, but not developed, right?
Exactly. They can also be hypothyroid, which might show up as incoordination or a poor suckling reflex. And critically, this is so important due to the mare's agalactia and that poor colostrum quality. These foals almost always suffer from failure of passive transfer FBT of antibodies.
Meaning they don't get immunity from the mom's milk.
Precisely. They don't get that crucial first gulp of antibody-rich colostrum, which leaves them highly susceptible to septicemia, blood infection, and all sorts of other infections. It's a major, major risk factor for newborn foals.
That's a lot for owners and vets to look out for. The impact on both mare and foal sounds really severe. With all those potential signs, it sounds like you said, a real detective job for the vet. What are the definitive clues they look for to actually confirm fescue toxicosis?
Yeah, it often starts with the history. The diagnosis is primarily based on that history of exposure. Did the mare graze tall fescue pasture? Did she eat fescue hay or use fescue straw bedding during her last trimester?
Location matters too, right?
Absolutely. Is the farm located in a fescue endemic region? That's a big clue.
Yeah.
Then, the clinical examination findings are key things like the mare's lack of udder development, the prolonged gestation, looking closely at the placenta after foaling, and of course, examining the foal's condition. All vital pieces of the puzzle.
Can you test the grass itself?
Yes, and for Definitive confirmation, forage testing is really the way to go. You can send samples of the suspected tall fescue pasture or hay to a diagnostic lab. They check for the endophyte's presence and, more specifically, they measure the ergovaline concentration.
Ah, that toxin again. Is there a level that's definitely bad?
Generally, levels above about 200 to 300 parts per billion are considered problematic for pregnant mares, though some sources suggest even lower levels might cause subtle issues. It's also important to know that these alkaloid levels aren't static.
They change.
Yes, they're highest in the plant's seed heads, and also tend to be higher during warm, dry weather, especially in late spring and early summer. And crucially, fescue hay retains its toxicity. Don't assume drying the grass makes it safe.
Good point. Hay isn't necessarily safe. What about blood tests?
Supportive blood work can help. You might see decreased maternal serum prolactin, as we discussed, and also lower progesterone concentrations, sometimes with increased estradiol 17. In the foals, you might find decreased thyroid hormones. And for the foal, that IgG test is absolutely crucial to check for failure of passive transfer.
Got it. And risk factors beyond just eating the grass.
Well, the concentration of ergovaline is definitely highest in those seed heads during the summer months. Conditions like drought or sometimes excessive rain followed by heat and nitrogen fertilization can actually increase the toxin levels. And here's a kicker. Endophyte-infected fescue is just tougher. It's hardier, more drought-resistant, more insect-resistant, so it tends to outcompete non-endophyte-infected fescue in a pasture over time.
So it takes over.
It does. It gradually dominates the pasture, increasing the risk.
This really highlights the need for proactive steps, which brings up the big question. What can horse owners actually do? Is prevention even possible here?
Oh, absolutely. And I really want to stress this. Prevention is much, much more feasible and significantly more cost-effective than trying to treat the problem once clinical signs appear.
Okay, so what's the gold standard for prevention?
The single most effective prevention strategy is simply removal. Get the pregnant mares completely off all sources of endophyte-infected tall fescue, that means pasture, hay, and even bedding well before their due date.
How far in advance?
We generally recommend a minimum of 3 to 4 weeks before the expected foaling date, but ideally 60 to 90 days or even removing them for the entire last trimester is best. Studies have clearly shown that even getting them off as late as 30 days prior to foaling can significantly reduce the severity, if not eliminate the clinical signs.
So removal is key. What about managing the pasture itself?
Yeah, pasture management is critical. Obviously, avoiding infected fescue altogether is the ideal, but that's not always practical. One strategy is to dilute the fescue by overseeding with other grasses like orchard grass or bluegrass and legumes like clover.
Dilute the toxin intake.
Exactly. A really fantastic long-term solution, though it requires renovating the pasture, is to plant novel endophyte fescue varieties.
Novel endophyte? What's that?
These are special varieties of tall fescue that still contain an endophyte fungus, so the plant gets all the benefits like hardiness, drought tolerance, insect resistance. But, crucially, these novel endophytes do not produce the toxic ergot alkaloids like ergovaline.
Ah, so you get the hardy grass without the poison.
Precisely. It's really the ideal scenario for many areas where fescue thrives. Also, simpler things help, like mowing pastures frequently to prevent the grass from forming seed heads, because remember, that's where the toxin concentration is highest.
Okay, but what if removal just isn't possible? Maybe space is limited or identifying the fescue is hard.
Right, sometimes it's just not feasible. In those cases, there is a pharmacological option for prevention. A medication called domperidone, available as Equidone gel, can be given preventatively.
Domperidone, how does that work?
It's given orally, usually at a dose of 1.1 milligrams per kilogram of body weight once a day, typically during the last 10 to 15 days of gestation. It helps counteract the effects of the ergovaline.
Okay, so removal first, pasture management, maybe novel endophytes, and then domperidone as a last resort for prevention. But what if? What if prevention wasn't possible or it failed and a mare is already showing these worrying signs like being overdue or having no udder? Is there anything that can be done at that point?
Yes, absolutely. If a mare is already showing signs of prolonged gestation or agalactia, that same drug, domperidone, remains the treatment of choice.
So it works for treatment too?
It does. Because it acts as a peripheral dopamine D2 receptor antagonist, it essentially blocks the harmful effects of those ergot alkaloids on prolactin secretion. It allows the mare's body to release prolactin normally again.
Okay, so it gets the prolactin flowing.
Exactly. And it can even be continued for about 5 to 10 days after foaling to help ensure good milk production and letdown.
Are there any downsides or precautions with using domperidone?
There are a few things to be aware of. Sometimes domperidone can cause leaking of milk or even colostrum loss before the mare actually foals. If that happens, the dose might need to be adjusted. And it's really vital to try and collect and save any colostrum that leaks out. That stuff is liquid gold for the foal.
Right. Don't waste the colostrum.
Definitely not. And you'll still want to monitor the foal's IgG levels closely after birth, just in case. Also, because domperidone stimulates GI motility, it should be avoided in mares that might have an intestinal blockage or perforation.
Got it. So beyond medication for the mare, what about supportive care, especially after the foal is born?
Oh, supportive care post-foaling is absolutely crucial. First, be prepared for dystocia. Given the high likelihood of an oversized foal, you need to be ready to assist with the birth if necessary.
Have the vet on standby.
Definitely. Then managing retained placentas is essential. This often involves interventions like giving oxytocin to help the uterus contract, sometimes uterine infusions, and possibly antibiotics to prevent infection.
And the foal. We know they're at high risk.
The foal needs immediate and intensive care. Always assume failure of passive transfer, FPT, because of the mare's likely lack of quality colostrum. Perform an immediate full-side IgG test to confirm their antibody status.
And if it's low?
You need to be ready with oral colostrum supplementation immediately, either from a frozen colostrum bank or a good quality commercial replacer. If the foal has confirmed FPT, a plasma transfusion might be necessary to give them that vital passive immunity.
So plasma might be needed.
Often, yes. Broad-spectrum antibiotics are also frequently given prophylactically to these high-risk foals to ward off infection. And of course, nutritional support is critical. If the mare truly has no milk, you'll need a good quality milk replacer or potentially find a nurse mare. It really is about doing everything possible to save that foal.
It sounds incredibly intensive, but vital.
It really is.
Yeah.
If we can, connect this back to the bigger picture, fescue toxicosis is clearly a major reproductive threat to our pregnant mares. It's primarily driven by those ergot alkaloids, especially ergovaline, messing with prolactin.
Right.
The cardinal signs that prolong gestation, the agalactia, the dystocia, those thick or retained placentas, and especially those weak, dysmature foals suffering from FTT, they're very distinct once you know what to look for.
And prevention is key.
Prevention is absolutely paramount. It really boils down to thoughtful pasture and feed management, getting mares off this stuff. And if removal isn't an option, then considering pharmacological intervention like domperidone. And always anticipate and be prepared for failure of passive transfer in foals born to affected mares. Plan for it.
So after this deep dive, hopefully you, our listener, feel like you have the knowledge now to really understand this complex issue. You can recognize the signs, and you know the vital steps for both prevention and management. And, this isn't just about horses. It's actually a fascinating example of how these intricate biological relationships, like the one between the fescue plant and its little fungal partner, the endophyte, can have profound and often unintended impacts on other species, especially when we humans are managing those ecosystems.
It's a powerful example of that interplay.
It really is. So here's a final thought for you to consider, something to maybe mull over. That endophyte fungus and the fescue grass, they have this mutually beneficial relationship, right? It makes the grass tougher, more resilient in difficult conditions. But for the pregnant mare grazing that same grass, it's profoundly toxic. What does this tell us about the delicate balance, the sometimes precarious balance within ecosystems? And maybe more pointedly, how can human management of agriculture, even when we have the best intentions, like breeding for crop hardiness, how can that unexpectedly shift the balance, often with significant and completely unintended consequences for other species sharing that environment?